Hello, everyone. My name is Shannon Whited, and for my health promotion teaching project, I will be talking about skin cancer screening and prevention methods. Um, Many people think that there is such a thing as a healthy tan, but that is wrong. Overexposure to UVA and UVB rays from the sun lead to premature aging of the skin as well as formation of cancer, known as melanoma. A tan may be desirable to so many people, including myself, but the fact is that more people need to be educated on the dangers of the sun's harmful rays and the consequences of overexposure. So, the first thing I'm going to talk about is that nurses really do play an important role in educating our patients about early detection of suspicious moles and protection measures for the skin and hazards of excessive sun exposure. Skin cancer are the most common cancers in the United States, and they are caused by a combination of genetic predisposition and ultraviolet radiation exposure. And fair skinned individuals are at the highest risk. So, the three types of skin cancer are basal cell carcinoma, which arises in the lower epidermis, and these are the most common skin cancers. These cancers arise in the sun exposed areas, usually on the head and on the neck. They are pearly white and tend to grow slowly and rarely metastasize. The second one is squamous cell carcinoma, arise in the upper layer of the epidermis, and these cancers are often crusted and scaly, red or inflamed, or ulcerated appearance, and they can metastasize. The last one is melanoma, the worst of all. Arising from the pigment producing melanocytes in the epidermis, it gives its skin its color, which is usually darker or black. So in advanced stages, it causes over 70% of skin cancer deaths, which is a huge concern. So the next thing I'm going to talk about is risk factors. If you have a family history or previous family history of melanoma, if you have any moles, if you have any atypical or dysplastic moles, if you're male, if you have 50 or more moles, if you have red or light hair, or light eyes, and if you are in the sun a lot, if you go to the tanning bed, if you're a sun baby, if you're outside all the time, you are definitely at risk for melanoma. And severe blistering sunburns, if you've ever had a sunburn that is blistered, or or were even worse if you had them when you were a child, or immunosuppression from HIV or chemotherapy. So preventing the best defense against skin cancer is to avoid ultraviolet radiation exposure by limiting time in the sun. So I did make 3 posters, and I'm going to have to just read them off because I don't think you guys will be able to see them. So the first poster that I did make, so I'm going to kind of get close so you can kind of see, but I'll read everything off. So skin cancer prevention, you want to wear sunscreen year-round, SPF 15 or higher every day for extended play, or SPF of 15 or higher. Avoid tanning and burning. Tanning beds emit UV rays and can increase your risk of skin cancer. You want to wear protective clothing, dark, that covers your arms and legs, and hats like big brimmed hats. Keep newborns out of the sun. Protect them from dehydration, high fever, blisters, infections, chills, and heat stroke. And certain medications. Check with your doctor or pharmacist about potential side effects of any medications you may be taking. Wear sunglasses that block both UVA and UVB rays. Most sunglasses that you can buy now actually have both of those, but there is some sunglasses that don't have any protection. Use extra caution near snow, water, or sand. These surfaces reflect the damaging rays of the sun, which would increase your chance of getting a sunburn. Check your skin regularly. Examine your skin often for new skin growths or changes in existing moles. Okay, so what I have over here as well, you want to use sunscreen appropriately, like I said over here, at least SPF 30, no indoor tanning, limit UV exposure between 10 a.m. to 4 p.m., seek shade when you can, We talked about the wide brimmed hat and sunglasses and protective clothing. You want to apply sunscreen 20 minutes before UV exposure and reapply every 2 hours or after getting wet. So if you get out of the pool, if you're in the ocean, you put sunscreen on before, wait a little bit, reapply it, and do that every 2 hours. And don't forget, some commonly missed areas are your lips, feet, back of your hands, and the top of your head. Most people don't think to put sunscreen there as well. So the teaching that I will be doing is the ABCDE model for skin cancer. I don't know if you can see, put a little picture on there. So A is for asymmetry of one side of the mole compared to the other. B is for irregular borders, especially ragged, notched, or blurred. C is for variation or change in color, especially blue or black. D is for diameter. It's greater than or equal to 6 millimeter or different from others, especially if changing, itching, or bleeding. E is for evolving or changing rapidly in size, symptoms, or morphology. So this is a kind of a picture of what a normal mole would look like. You can tell they're all round. And down here, this is melanoma. You can tell it's asymmetrical. The borders are uneven. It's not perfectly round. Different colors in this one. And it is larger than a 1/4 inch. And you can see by these pictures, and I don't know if you can, let me get them closer to the actual screen. You can tell the difference. And if you go by the ABCDE model for skin cancer, I think you can definitely tell or distinguish between the two. Okay, so the next thing is instructions for skin self-examination. This is also very important to check your skin regularly for any changes. So things you will need is a full-length mirror, a handheld mirror, and a well-lit room. So if you can see in the picture, if I can get it even closer, kind of shows you. So the first thing you want to do is examine your body front and back in the mirror, then right and left sides with your arms raised. Bend elbows and look carefully at forearms, upper forearms, and palms. Look at the backs of the legs and feet and spaces between the toes and sole. Examine back of neck and scalp with a hand mirror and part hair for a closer look. Finally, check back and buttocks with hand mirror. So the American Academy of Dermatology recommends regular self-exams of the skin using this following technique. So this is the technique that you should use. In patients with risk factors for skin cancer and melanoma, history of high sun exposure, prior or family history of melanoma, or patients with 50 or more moles, or more than 5 to 10 atypical moles should perform a regular self-skin examination. Approximately half of melanomas are initially detected by patients or their partners. So that's definitely something to think about. So that is it. I hope you guys liked my video and I hope you learned something, and thank you very much. Bye.